Hello, I'm Sister Tandy. We have arrived at the final video of Phase 5, and in many ways, the final video of this entire portal. We have traveled together through medical findings, mental wellness, industry-specific health risks, and the values that define what truly human occupational health looks like. Today, we are looking forward. What is coming? At the technologies, tools, and possibilities that will transform occupational health in South Africa over the next decade. And at the one thing that no technology will ever replace, the human touch. Let's close well. South Africa's occupational health landscape in 2026 is one of contrast. In some industries and urban centers, digital records, mobile clinics, and telemedicine are already standard. In others, particularly in agricultural, mining, and deep rural settings, workers may travel hours for a basic medical examination or never receive one at all. We have 4 fixed clinics and 16 mobile units. We are reaching more workers than ever before. But the scale of need in a country with this workforce size means that technology is not optional. It is how we close the access gap. It is how we ensure that the worker in Limpopo receives the same standard of care as the worker in Sandton. That is not an ambition, it is a responsibility. Telemedicine is not a future concept. It is a present reality that CNC Consultants is expanding. What does telemedicine mean in occupational health? It means that a worker in Uppington with elevated blood pressure can have a consultation with a CNC Consultants occupational health practitioner via video call within 48 hours of receiving the written result. It means that a transport company manager can receive a digital briefing on their workforce's medical surveillance outcomes from their desk in Cape Town, while the workers are being examined on a site in Polokwane. This means a mine manager can access a real-time compliance dashboard on a mobile device during an inspection. Telemedicine is distance removed, care delivered. Artificial intelligence is entering every field, and occupational health is no exception. The promise of AI in our field is significant. AI can analyze audiometry trends across a workforce of 5,000 workers and identify patterns suggesting inadequate PPE in a specific department in seconds, not months. AI can flag that a worker whose blood pressure has been creeping upward over 6 examinations may be approaching a critical threshold before it is crossed. AI can automatically match medical surveillance schedules to legislative requirements across multiple industries and geographies, with 0 administrative errors. These are not replacements for clinical judgment. They are amplifiers. They free up the practitioner to spend more time on the part of the work that no algorithm can do, being present with a person. Here is what AI cannot do. It cannot look a worker in the eye and notice that something is wrong before the test result confirms it. It cannot sit with someone who has just received a frightening medical finding and say, "Let me explain this clearly and let me help you understand what to do next." It cannot hear the catch in a voice that suggests more is going on than the question being asked. The practitioner who remembers a worker's name from the last visit. The mobile clinic driver who greets the night shift team by name every quarter. The account manager who sends a message when a client's compliance review goes particularly well. These are the moments that technology cannot build. They are built by people who care. CNC Consultants exists because of those people. Because of you. The worker of the future in South Africa is not passive. They arrive at their occupational health examination having already looked up their previous results on My Clinic online. They ask targeted questions. My blood pressure was 138/88 last time. What is it today? Is it trending better? They understand what their certificate of fitness means and when it needs to be renewed. They know their rights. They know the SADAG helpline number. They are the wellness champion for their team. They speak openly about stress and do not carry it alone. This is not a distant dream. This is what happens when workers are given access to information, treated with dignity, and empowered to take ownership of their health. CareNet Consultants is committed to being the partner that makes this possible. By 2030, CareNet Consultants aims to be South Africa's largest SME in the occupational health sector, not measured by revenue alone, but by reach, by impact, and by the depth of health transformation we catalyze. Our vision includes expanding digital health pods to bring occupational health services to underserved communities, a MyClinic online platform that includes worker-level wellness tracking and personalized health coaching. Telemedicine consultations are available in all 11 official languages. AI-driven compliance management that anticipates legislative changes before they take effect, and a workforce of occupational health practitioners that reflects the diversity of every community we serve. This is the CareNet Consultants we are building, and we are building it with you. You have watched this entire video series or arrived at this final video from wherever your journey began. Either way, here is your invitation. If you are an employer, let us review your current occupational health program together in one conversation. No obligation. A CareNet Consultants account manager will meet with you, understand your current situation, and tell you honestly what we think could improve. If you are a worker, know that your health matters. Your rights are real. Your questions deserve answers. And if anything in this series raises concerns about your health, please act on them. Contact CareNet Consultants. Contact your GP. Contact SADAG. Whatever the first step is, take it. We are here. We are ready. And your best is already good enough for today. We began this portal with a promise to be your partner in workplace health. Not your vendor, not your compliance administrator, your partner. Every video in this series has been built on a single conviction, that the health of a workforce is the health of a community. That is when a worker in Elandsfontein is genuinely well, truly well, in body and in mind, their family is stronger, their community is stronger, and South Africa is stronger. Ubuntu, umuntu ngumuntu ngabantu. I am because we are. CareNet Consultants exists on that web. We exist because you exist. We do what we do because your health, your dignity, and your well-being are worth doing it for. Thank you. From all of us, every practitioner, every administrator, every mobile clinic driver, every person behind this work, thank you for trusting us with something this important. Before you go, for the last time in this series, here is something worth carrying with you. Research published in The Lancet found that people who believe their work has meaning live an average of 7 years longer than those who do not, regardless of income, education, or physical health status. Your work matters. You matter. From all of us at CareNet Consultants, your best is good enough for today and every tomorrow too. Ubuntu. I am because we are. Goodbye. CareNet Consultants, your partner in workplace health.